Imagine the year is 2020. The national healthcare system is dysfunctional with rising healthcare costs, lower levels of quality and patient safety, and high staff turnover. Nurses, the major caregivers and coordinators of healthcare systems, are too few in number to provide high-quality care for the emerging diseases and aging population. In the U.S. today, Tennessee ranks lowest in the supply of nurses to our patient population. By 2020, without successful intervention, training, and recruitment, Tennessee is projected to meet only 49% of the demand for nurses. Research findings indicate that lower nurse staffing levels lead to decreased quality of care and high rates of poor and adverse patient outcomes. Located in Memphis, Tennessee, the Nursing Institute of the Mid-South provides a gateway to nursing excellence in the region and provides the means to avoid this potential perfect storm looming for 2020. Nursing Institute of the Mid-South, a nonprofit organization, was founded in 2008 by local nursing directors and academic leaders who had an understanding of the future needs and a desire to collaborate toward effective solutions. Dr. Paula Spears designed a program for clinical nurses to receive individualized training and continuing education and acquired a 3-year grant from the U.S. Department of Health and Human Services.
EPIC stands for Nurses Leading Excellence in Practice, Innovation, and Care. The EPIC program was created as a result of a needs assessment about comparing our healthy practice environments to the best evidence for healthy practice environments. And as we made that assessment, we learned there were opportunities to provide to our nurses clinical leadership training and development. And so through the EPIC program, we're able to help nurses learn to be better team leaders, better peer colleagues with the nurses and the clinical staff that they work with, and improve patient outcomes, which, after all, that's exactly what we want to be about, and that is making sure that our patients in the Mid-South have high-quality care.
Since 2009, the Nursing Institute, through the EPIC program, has provided a gateway to nursing excellence, bridging the gap between the academic and the healthcare institutions by increasing nurse competencies in patient care and communication, team and organizational skills, competency assessment, and individual coaching. EPIC nurses excel in patient care and communication competencies.
Our QI project through the EPIC program is looking at compassion fatigue, resilience, and coping among pediatric oncology nurses. We're looking at compassion fatigue with the nurses because when they deal with children who are ill, they secondhand sometimes experience those struggles. And by helping these nurses take care of themselves better and teaching them those coping tools, we'll be also helping them to provide better care for our patients.
We have a profession unlike any other profession. We have different attributes and different qualities, such as our knowledge and our skills, understanding, and our patience. The EPIC program has enhanced those qualities for me, and now I'll be able to help nurses at the VA, encourage them, inspire them for the present and in the future.
The EPIC program really helped us at Methodist North with our bedside reporting by helping us to really understand the cultures and the personalities of people better. And so when we actually started training the nurses on how to do the bedside reporting, it really helped us to have a better understanding of where they were coming from culturally and based on their personalities, so we could actually train them a lot easier and to have a better understanding of where everyone was coming from.
Before I started the EPIC program, I wanted to go overseas and do nursing overseas. But talking to my coach, I realized there are so many different opportunities to serve here in Memphis. I'm a nurse at Le Bonheur on the pulmonary unit, and I realized that my calling is to work there and to work with the cystic fibrosis kids. I love to be a part of their lives. They're in and out of the hospital so many times throughout the year that you get to be a part of their homecoming, their prom, birthdays, and other family events.
EPIC nurses excel in team and organizational skills.
My coaching experience with EPIC was very positive, and it helped me focus on my strengths and my weaknesses. It helped build my confidence and, build skills that helped me focus more on team building and bringing my team together.
For the past 4 months, I have been going through coaching sessions through the EPIC program, and I've been speaking about my current goals and my future goals and how I can better myself as a nurse. And I feel that the coaching session really helps me think about who I am and the changes I need to make to become a better nurse and a better person.
When I first started out as a nurse, I would try to remain low-key, just come into work, do my job, and go home at the end of a shift. But since being a part of EPIC, I've realized the power and the value of being a leader and what it brings to Methodists, to myself, to my teammates, and to the patients who I take care of.
EPIC competency assessment and coaching experiences exceed student expectations.
EPIC has meant a lot professionally as well as personally. Throughout the program, we did a personality test, and I learned that my weakest point is in conflict resolution. So throughout the program, we went through education classes as well as coaching, and I learned ways to resolve conflict instead of avoiding it, which was my main mechanism of resolving conflict. So for example, if there was something that I needed to communicate to a coworker, most often I wouldn't, or I would just rather do it myself as opposed to delegating. But instead, throughout the coaching, we learned how to approach conflict even with our coworkers and to do it effectively in order to get the desired effect. Another thing I learned was goal setting, and at the beginning we just set about 10 goals, professional and personal, short-term and long-term. And one of the goals that I actually got accomplished was a mission trip that I have been trying to do for years. And so I went on my first international mission trip this year. I know it's just because I set that goal and put it down on paper.
Coaching has helped me tremendously because at the Med, I work with different people in all walks of life. And I would say it has made me come out of my shell, so I'm more effective in what I do every day.
I was fortunate enough to participate in EPIC just before I transitioned in my new role at St. Jude, and it helped me differentiate between different generations because under me I have staff members that are older and younger, and to see where they're coming from, understand their values and their work ethic, and how to apply it to do the incentive that they need to move forward. Also, it helped me to keep myself accountable as well as everybody that is in my unit, and to understand better what my goals are and to move forward in that direction.
As a nurse at Methodist South, EPIC has allowed me to become a stronger leader. A part of the EPIC program, we take the Myers-Briggs personality assessment, and it's allowed me to determine which area I'm more dominant in, whether it's being a clinical leader or a nurse practitioner in regards to continuing my education and obtaining a master's degree.
Extensive training is provided through the EPIC program. Excellence in practice, innovation, and care. This collaborative training mission is accomplished through academic partners in excellence. University of Tennessee, University of Memphis, Union University, and Southwest Tennessee Community College. Healthcare educators are impressed with EPIC's results.
The Nursing Institute is all about patient care. It's all about delivering high-quality patient care. And the Institute has had a program called EPIC. That EPIC program basically works with and deals with nurses at the bedside level, producing nursing leaders to promote the best optimal patient care possible.
The coaching component of the EPIC program is one of the things I felt that set it apart from other leadership and development programs that I've had an opportunity to participate in. It gave you an opportunity to actually bounce ideas off of another leader, share real-time, daily issues that we struggle with, and get feedback in the moment. The program was so successful and the coaching component was so important that I actually suggested the Tennessee Center for Nursing find a way to develop and implement this statewide at other hospitals throughout the state of Tennessee for our nursing leaders.
It's very exciting to see the growth and development in each of the individual EPIC participants.
to see how they have taken ownership for the quality of care that's provided in their departments, and to see them grow in the individual as individuals in their profession.
The success of EPIC's training program is also due to the leadership of the healthcare partners in excellence: St. Jude Children's Research Hospital, the Regional Medical Center, VA Hospital, and Methodist Le Bonheur Healthcare Systems. Healthcare providers highly praise EPIC's excellence in training.
The nurses at St. Jude that participated in the EPIC program really grew and matured professionally by their involvement in this. They learned that they could question their practice, research the evidence, and come up with a plan for how to make care better. And by doing so, they saw that they were really able to impact a more positive outcome in their patients. That really gave them a tremendous sense of pride, and all of us a big sense of pride in seeing the work that they were doing.
The coaching sessions that I had the opportunity to go throughout the EPIC program really helped me develop from a professional standpoint. I had the opportunity to work closely with some of the individuals throughout the program to help develop skills needed to pass a certification exam to really enhance my professional credibility. In addition, the coaching sessions really helped me develop my own communication skills and helped me feel more comfortable in holding employees accountable as well as myself. Because of all of these things, I really feel like there's been a greater sense of communication and team cohesiveness on the solid tumor unit at St. Jude, ultimately creating a more positive environment for our patients and families.
We are so excited at the Regional Medical Center in Memphis this year to be part of the EPIC program. We have 2 units that are involved this year. The staff are so excited. They're realizing that at their level they can make changes. They've been given the tools to make these changes, and their enthusiasm has caught on to all levels of the staff. What I really see coming from this program is they realize they can make changes in healthcare, and this can be for the city of Memphis as well as hospitals across this region, across this state, and actually across the country.
We ask you to join us in our commitment to excellence in nursing through continued support and the establishment of Nursing Institute of the Mid-South as a permanent partner in excellence. Nursing Institute of the Mid-South, the gateway of excellence for our nurses of the future.